Hey there, I'm Dr. Chad Woolner. I'm a chiropractor in Meridian, Idaho. What I'm going to share with you today is an issue that a lot of patients come into our clinic with and they don't really know that they have this. One of the most commonly misdiagnosed conditions or problems is carpal tunnel syndrome. A lot of times people come in thinking that they have carpal tunnel syndrome. They've been told by a doctor that they have carpal tunnel syndrome because they have symptoms in their hand. And sometimes they even have the classic distribution of symptoms in the thumb, finger, and then half of the middle finger there. So it would definitely look like that, and sometimes they even have the symptoms in the wrist as well. That could very well be carpal tunnel, but oftentimes there's another problem that masquerades and looks a lot like carpal tunnel, but it's not carpal tunnel. It's a little less known, less well known, called Pronator syndrome. And basically what happens is you get irritation of a deep muscle here in the forearm. It attaches, or it starts right about there and then comes over that direction. And the reason why this is kind of an important muscle is it travels directly over the top of the median nerve, the same nerve that's affected with carpal tunnel syndrome. And so if this muscle gets overly tight, irritated, inflamed, it can create symptoms on that, or create pressure and irritation on that median nerve, sending symptoms in the same exact distribution. And so sometimes we see Pronator syndrome all by itself. Sometimes we see it in conjunction with carpal tunnel syndrome, because a lot of times this muscle is involved in the same sorts of motions with carpal tunnel syndrome. The Pronator takes the wrist from this position, what we call a supinated position, and pronates it, hence the term Pronator teres. And so it brings that wrist over. So same sorts of tasks and jobs that would irritate this area here can also irritate that area there. So whether you have carpal tunnel syndrome or just these same sorts of symptoms, you may have Pronator syndrome. So it's a very straightforward condition for us to treat. There's a couple different things we do. One of the things we do is we just do some stripping of that muscle. We'll get in and we'll have the patient go into that pronated position, and then we'll actually we'll pin in on that muscle belly in there, and we'll actually have the patient supinate over. And so that stretches that muscle and kind of helps provide a little bit of relief in that area. And so we'll usually do a series of stretching exercises like that with the patient, followed by icing to kind of help reduce some of that inflammation and irritation. There's a whole other protocol of things that can be done, ranging from cold laser therapy or low-level laser therapy. Sometimes some therapists will use ultrasound to kind of help reduce some inflammation in that area. But really the fundamental key that I'm trying to get at here is if you have carpal tunnel symptoms, you may have carpal tunnel syndrome, but you may also have, or instead have, Pronator syndrome. So just something to be aware of, something you can look out for if you have any of these symptoms. If you're looking for help with that, feel free to give us a call. We'd love to help you out. So anyways, if you have carpal tunnel symptoms or problems, it may very well be Pronator syndrome as well, or instead. So thanks for watching this video. Hope you got a lot out of it. Until next time, see ya.